My journey in medicine has been emergency medicine and hospitalist medicine. And when I was a hospitalist, I worked as a nocturnist for 5 years, always working at night. Now, what I was able to do was take the disease states that I saw at night and put it into a curriculum to teach you how to assess acutely presenting patients. So it has to do with, you have to know your labs really well. You got to know renal functions, you got to know hepatic functions, you got to know cardiac enzymes and blood gases. Well, working at night, I didn't have a doc looking over my shoulder, and I taught lab medicine for 9 years, so I simplified it. I made it really easy to understand. So hospitalist medicine is really diving deep into your diagnostics. So number one is your labs. You'll know them like the back of your hand, and I think a lot of times we become providers and we stop learning maybe some of the basics. I'll make them super easy to understand. Second part of that is how to read a chest x-ray and how to assess a pulmonary patient. And I have a mnemonic that is flawless. There's only 5 classes of pulmonary patients. The mnemonic is HORID, H-O-R-I-D. You don't make a horrid mistake if someone's short of breath. Is it their heart, obstruction, reactive infection, or death from a PE? So I will teach you how to clinically assess them in the hospital, especially if they're crashing or getting sick. The third part of this series is chest pain, the PAPA mnemonic, and the high-risk chest pain EKG findings. So PAPA is a mnemonic. There's no exception to this. It's who's your PAPA. There are 5 causes of chest pain. PAPPA. It's pericarditis, acute coronary syndrome, pneumothorax, PE, and aneurysm, thoracic dissection. So I teach you how to assess them, how to clinically treat them, and also I have a bunch of mnemonics for the EKG program. Now, be mindful of something. The EKG portion is not for the beginner. Okay, if you're not really sure what a PR interval is or P-wave or QS complex, if that's you, don't get this program. So you got to start something more basic. This is kind of the advanced curriculum. Now, we have a black belt EKG program that'll take you from knowing nothing to being a black belt, really having a good understanding. It's our highest selling program, that black belt EKG program, but that's not what the hospital's program's for. It's for people who have fundamental understanding of EKG. We're just going to take you to that next level. Good luck and God bless.